Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Atrial fibrillation. Introduction. Atrial fibrillation is an abnormal, irregular heart rhythm. It typically causes a rapid heartbeat.
Atrial fibrillation is usually not life-threatening, but it may require immediate medical attention because it can lead to life-threatening strokes.
This program will discuss the symptoms and treatment options for atrial fibrillation. Anatomy. The heart is the most important muscle in the body. It is formed by two sides, the right side and the left side. Each side has two chambers, an atrium and a large ventricle. Blood comes from the body to the right atrium. From there it is pumped to the right ventricle. The right ventricle pumps the blood to the lungs. In the lungs, oxygen is delivered to the blood. From the lungs, blood goes to the left atrium and then to the left ventricle. From there it is pumped to the rest of the body. Heart contractions are synchronized. A normal heart rate varies between 60 and 100 beats per minute while a person is at rest. The muscles of the heart contract and pump blood because they are stimulated by a small electric current. The electric current in the heart starts in the area of the atria known as the sinus node. It causes the atria to contract and pump blood to the ventricles. From the sinus node, the electric current travels through fibers, similar to electric cables, to another area of the ventricles known as the atrioventricular node, or AV node. From the AV node, the electric current goes to the ventricles and causes them to contract and pump blood. Atrial fibrillation. Atrial fibrillation happens when the electric current in the heart is generated from all over the atria at a very high speed, between 300 and 500 impulses a minute. This does not allow the atria to contract in a synchronized fashion. Because of the high number of impulses generated by the heart and their location, the atria begins to quiver. This is known in medical terms as fibrillation. When this happens, the ventricles contract independently from the atria. This causes a fast, irregular heart rate between 80 and 160 beats per minute. Such a rapid and irregular heart rate causes some blood to remain in the heart after every contraction. This results in blood pooling in the heart chambers, which increases the risk of blood clot formation. These blood clots can get dislodged and travel to the brain and lungs, where they could block the flow of blood. When the flow of blood is interrupted, a fatal or disabling stroke could happen.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Causes. Coronary artery disease and heart failure are the two main causes of atrial fibrillation. Rheumatic heart disease, which affects the valves of the heart, also increases the chance of atrial fibrillation. Hypertension and diabetes can also play a role in damaging the atria of the heart and can cause atrial fibrillation. An overactive thyroid gland can also cause the atria to fibrillate. Chronic lung diseases such as COPD could cause atrial fibrillation. Inflammation of the lining surrounding the heart can also cause atrial fibrillation.
Atrial fibrillation is often caused by an underlying disease. However, there are few cases of atrial fibrillation with no apparent causes. This is called lone atrial fibrillation.
Symptoms. Atrial fibrillation may not have any symptoms.
Most patients do feel chest palpitations and possibly skipped heartbeats. Symptoms may also include confusion, dizziness, fatigue, shortness of breath, Weakness.
If the heart rate becomes high or if the heart becomes unable to pump blood adequately, patients may feel chest pain, known as angina. They may also feel lightheadedness and may even faint. Diagnosis. Atrial fibrillation is diagnosed by an electrocardiogram, also known as an EKG. This test takes only a few minutes. During this test, electrodes are placed on the chest and body to record the heart's electrical impulses.
Because atrial fibrillation comes and goes and may not happen during an EKG, you may be asked to wear a portable EKG. This portable EKG test, known as a Holter monitor, lasts for 24 hours. An event recorder may also be used. It is an EKG that measures your heart's activity for a few weeks or months.
Your healthcare provider will also want to determine what is causing atrial fibrillation. He or she will check your heart, blood pressure, blood sugar, and levels of thyroid hormones. Treatment. Some cases of atrial fibrillation may improve on their own. If this happens, your healthcare provider will still perform tests to make sure you do not have any of the diseases that can cause atrial fibrillation. If atrial fibrillation persists, your healthcare provider can treat it in one of several ways. The underlying cause of atrial fibrillation will have to be treated. This sometimes causes the heart rate to become normal again. For example, if atrial fibrillation is caused by an overactive thyroid gland, the thyroid gland may be removed surgically or destroyed through radioactive iodine. If a heart valve disease causes atrial fibrillation, a valve replacement surgery may be necessary. Controlling high blood pressure and your blood sugar level, as well as preventing any further heart problems, may also help in some cases.
Blood thinners may be given to prevent blood clots from forming in the heart.
Cardioversion.
If atrial fibrillation does not improve, other procedures may be tried. Your healthcare provider may attempt to revert your heart rate to normal. This is known as cardioversion. Cardioversion can be done with various medications or using an electric shock to the chest area. Depending on the patient's condition, another procedure called catheter radiofrequency or cryotherapy ablation may be attempted. During this procedure, parts of the electrical pathways of the heart are destroyed using a small electric current or extreme cold.
This current is delivered to the heart using a catheter that is threaded through the blood vessels and into the heart. After this procedure, a pacemaker may need to be placed because the heart loses its ability to generate and regulate the heartbeat.
Open heart surgery may be required to fix the electrical problem in the heart. Your healthcare provider will create scar tissue in the heart to restore normal function. This is called a maze procedure. AV node ablation is an option when other treatments are not effective or are not recommended. Radiofrequency or cryotherapy is used to stop the electrical signals between your upper and lower heart chambers. A pacemaker is then inserted to tell the lower chambers when to pump.
Patients may also be placed on long-term medications to prevent the atrial fibrillation from recurring. Anticoagulation or blood thinning. If cardioversion is not successful, the risk of blood clots forming inside the heart becomes very high. Blood thinners are then administered to help decrease the chance of blood clots forming. Pradaxa, or dabigatran, is a blood thinner that is increasingly used to prevent strokes in patients who have atrial fibrillation not related to heart valve problems. Unlike warfarin, which is another blood thinning medication used to treat some cases of atrial fibrillation, taking this blood thinner does not require any blood level monitoring. Warfarin is also known as Coumadin.
Newer anticoagulants are also available. Ask your healthcare provider which medication would be best for you.
All blood thinners have potential significant side effects that will be explained to you. Some blood thinners require you to have regular blood tests. If you are prescribed one of these blood thinners, your healthcare provider will need to check your blood regularly to prescribe the correct dosage. Regular follow-up visits with your healthcare provider are essential in preventing complications due to atrial fibrillation or warfarin. Prevention. The best way to prevent atrial fibrillation from happening is to take steps towards keeping your heart healthy.
These steps include 1. Not smoking. 2. Eating a healthy and balanced diet. 3. Controlling your blood pressure and blood sugar levels. 4. Exercising regularly under your healthcare provider's supervision.
Unfortunately, atrial fibrillation may not be totally preventable. Long-term treatment of this condition may be needed.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Atrial fibrillation is an abnormal, irregular heart rhythm. It typically causes a rapid heartbeat. Atrial fibrillation is a serious disease. It can cause blood clots that can travel from the heart to the brain, resulting in a stroke.
Atrial fibrillation happens when the electric current in the heart is generated from all over the atria at a very high speed, between 300 and 500 impulses a minute. This does not allow the atria to contract in a synchronized fashion, and the atria begin to quiver. Coronary artery disease and heart failure are the two main causes of atrial fibrillation. But there are several other medical conditions that can cause atrial fibrillation, including rheumatic heart disease, hypertension, and diabetes. Some cases of atrial fibrillation clear up on their own. If atrial fibrillation persists, your healthcare provider can treat it with valve replacement surgery, cardioversion, or blood thinner medications. You can prevent atrial fibrillation from happening by keeping your heart healthy, not smoking, eating a healthy and balanced diet, and exercising regularly can help your heart stay healthy.
Most patients can still live a healthy and productive life after treatment. It is important to follow up with a healthcare provider regularly. Thank you for using Explain.